A few weeks back, Secretary of the U.S. Department of Health and Human Services Robert F. Kennedy Jr. came under fire for his controversial comments on autism. Kennedy held a press conference about a new CDC report showing a rise in autism diagnoses among children. There, he claimed that autism destroys families and suggested that people with the disorder will never hold a job, go on a date, or play baseball. While it's true that 1/4 of autistic people have severe limitations, the majority don't face the challenges Kennedy describes. Like many conditions, autism is a spectrum, meaning no two people are exactly the same.
Autism is a developmental disability that occurs throughout someone's lifetime, and it's really important to recognize that it is a unique journey and experience for everyone. So I know plenty of people that hold jobs and pay taxes and go on dates and have hobbies and do all of the things that neurotypical people strive to do as well. And then I know autistic individuals that have more complex care needs are equally as worthy and valuable to their communities and families and deserving of love and support and recognition.
That's Kristyn Roth, Chief Marketing Officer of the Autism Society of America. She says many autistic people lead completely normal lives, and many go their entire lives without being diagnosed, though that's slowly changing. As awareness and understanding of the disorder improves, more kids, teens, and even adults are being diagnosed. So while autism diagnoses are rising, there's no evidence supporting that more people are being born autistic. We're just getting better at recognizing it.
So the latest CDC numbers came out, and the numbers are 1 in 31, and so this is a higher prevalence estimate than the previous one, which was 1 in 36. There are still many disparities in diagnostic rates for certain groups. So although we see that the overall prevalence is going up, I want to emphasize that the criteria in the DSM for autism was primarily created based on cases of boys, and 80% of autistic females are still undiagnosed at age 18. So boys are far more likely to actually have an autism diagnosis, even when girls have documented autism traits in their educational and their clinical records. So some researchers have found that autistic girls, their autistic traits need to be, quote, exaggerated to actually receive a timely diagnosis.
That's Emily Hotez, Assistant Professor and Developmental Psychologist at the University of California, Los Angeles. She says this gender disparity exists because autistic girls are much better at hiding or camouflaging their autistic traits than boys. This ability to blend in can delay or lead to a misdiagnosis. Understanding this phenomenon has been critical in tailoring markers for women and girls.
There's been a really interesting research base that has been accumulating over the past few years on this concept of camouflaging. And that basically means masking or hiding autistic traits to appear more, quote, normal. And researchers have found that autistic girls are more likely to engage in camouflaging. So they're more likely to try to kind of conceal the traits that are associated with autism. And this happens in schools and in families. So a lot of times teachers just simply aren't picking up on it, and similarly families aren't picking up on it. A lot of times this can look like overcompensating for things like lack of eye contact or trying extra hard to fit into social situations or mirroring what they're seeing in social situations.
Girls aren't the only ones who are underdiagnosed. Racial and ethnic minorities are too. There's no evidence that autism occurs more or less based on race, ethnicity, or gender. Researchers like Hotez are still working to pinpoint the exact causes of autism, but one thing is clear. It's not something you catch. It's something you're born with.
One of the largest autism organizations that exists, the International Society for Autism Research, or INSAR, they just put out an official statement on declaring their perspective on what they think about all of this conversation about autism. They say high-quality research, much of it conducted by INSAR members, has found approximately 200 genes linked to autism, identified brain signatures related to autism, and referring to autism as a preventable disease is out of touch with contemporary evidence-based understanding of autism. Based on current autism research, we know that there are many causes of autism, and virtually all of these occur prenatally. In other words, you are born with autism.
Despite this, RFK Jr. claims that autism is preventable, and it's caused by environmental toxins rather than genetics. Since these comments, Roth has seen a significant increase in traffic to the Autism Society's national helpline.
We have autistic individuals and families that are calling us, grappling with their self-identity and self-worth, asking if society as a whole is going to be further discriminating against them with some of the claims or misinformation that's kind of being circulated right now. And that has real life outcomes. There's an incredible amount of emotional and mental load that people are taking on with this right now. And I think it's important to note that autistic individuals are constantly battling against systemic barriers their entire life. And to hear this type of language and rhetoric being discussed at the highest level in such a national stage is further objectifying their experience.
And this goes far beyond emotional and mental turmoil. Autistic people are much more likely to develop a range of physical health problems due to the stress that comes along with stigma, social isolation, and rejection.
Autistic people experience really pronounced health problems throughout the life course. So they have a lower life expectancy. They are disproportionately likely to have cardiovascular disease, diabetes, dyslipidemia, rare conditions like stroke and Parkinson's, even disproportionate suicidality. And I want to emphasize that those things are not part of an autism diagnosis. A lot of times, these are due to really highly preventable circumstances. Things like lack of access to high quality and consistent healthcare over the lifetime that is not fragmented and is led by healthcare providers who are really knowledgeable about autism. It could be due to stigma and discrimination and isolation and rejection and all kinds of other things that we call the social determinants of health. That means that we as a society have an opportunity to reform those factors to better support autistic people.
These reforms include better medical training on how to work with autistic patients and the build-out of safer, more supportive spaces in schools and workplaces. However, the goal with these efforts isn't to fix or cure autistic people, but rather to improve their quality of life. It's also important that these support systems recognize the strengths that come with the disorder. Autistic individuals are often described as highly intelligent, creative, honest, and loyal. And because every autistic person has their own unique mix of strengths and support needs, Roth says it's vital that these social services exist. However, government funding cuts have put some of these essential programs in jeopardy.
When you look at the expansive services needed for autistic adults to thrive in a community of their choosing with the proper home and community-based services, those are also being affected with funding cuts, sweeping layoffs, and that is reducing the number of quality supports for people to live fully in their communities.
Hotez believes that right now is a critical moment to support this population. She has a sister with autism and has witnessed firsthand how negative rhetoric can lead to isolation and regression. Whether or not you personally know someone with autism, Hotez says now is the time we should be inviting people in, not pushing them out.
I'm really privileged to have a lived experience of having a really authentic and meaningful connection with an autistic person. I want to emphasize that these negative messages about autism that are happening in public discourse can only further stigmatize and marginalize and exclude people like my sister who already experience lots of interpersonal healthcare and social stigma. And it's not helpful for promoting the health and well-being of autistic individuals and their families. I think the more unified we are in efforts to support this population, to support people like my sister, the better off we are in supporting everybody.
To find out more about Kristyn Roth, Emily Hotez, and all our featured guests, visit viewpointsradio.org. For more behind the scenes, check out Viewpoints Radio on X, Facebook, and Instagram. This segment was written by Grace Galanti. Our executive producer is Amira Zavari. Our studio manager is Jason Dickey. I'm Gary Price.